7, you're watching CT Style, and in your health news today, if you're considering bariatric surgery, you might be wondering how your diet is going to change.
Yeah, our friend News 8 medical reporter Jocelyn Momenta sits down with Griffin Hospital to get all those answers.
News 8 is partnering with Griffin Health to help you lead a healthy lifestyle. I'm joined by Dr. Abe Friedman, Director of Metabolic and Bariatric Surgery at Griffin Hospital. It's great to have you with us.
Thank you for having me.
What is it about bariatrics that people just do not know about?
So I think to a lot of people, bariatric surgery is just about weight loss. They think, oh, I have weight to lose, I need to get surgery to lose the weight. But there's a lot more benefits to surgery than just weight loss. Diabetes, one of the big medical problems nowadays, goes away. High blood pressure goes away with weight loss. Sleep apnea, a much lower risk of cancer down the line as well. So it's not just the weight loss.
Right, and bariatric surgery obviously has this impact on weight loss. So what are some of the latest procedures?
So some of the procedures that are done out there, there's a gastric bypass, there's a sleeve gastrectomy, and there's a lap band.
Who's eligible for this type of procedure?
So a lot of more patients are eligible than they think. You know, people have to look at their BMI, that's their body mass index. And the way they could find out their BMI, they could just go on Google, put in BMI calculator, and they'll get a number of results, probably in their height and their weight. They'll give you their BMI, and as long as their BMI is above 35, and they have some sort of medical problem to go along with it, or if their BMI is above 40, then they're considered, good candidates for the procedures.
And BMI is body mass index?
Correct.
What about weight, though? Do you look at that at all?
So it's not just weight, it's also height. So
Okay.
kind of you have to, compare the two, because some people are really tall and their weight is more so than someone who would be short at the same weight. So.
Very good. Any clinical trials going on at Griffin regarding bariatrics?
Not right now, but Griffin Bariatrics is kind of a full spectrum weight loss facility. We do surgery, we do nutrition counseling, there's an exercise program, support groups, a number of things that are specifically available at Griffin Hospital.
Yeah, we're really talking about treating the patient as a whole.
Correct.
More of a holistic approach.
Correct. So surgery helps people, but also with surgery, you need support, you need nutritional counseling, you need psychological counseling as well, and all of that is available at Griffin Hospital for all patients that want to.
Why is that so important when it comes to treatment?
Because when you have bariatric surgery, it's not just surgery. It really is a lifestyle change. So patients have to learn a new way to eat. They have to learn a new way to think about food, to think about things. So I think if you just do surgery and then you kind of go on about doing whatever it is you were doing, it's just not going to be as successful. So you really need a full program for that.
So how do you counsel people when they come in and they want to look into bariatric surgery? What is it that you want them to think about?
So I just want them to think about their overall health, longevity, and surgery is really not as scary and as dangerous as a lot of people think. It's one of the safer procedures you could have nowadays. A lot of people do well. There's almost 100% improvement in quality of life after surgery. And it's something that people can just check out. They go to a free informational seminar, they hear about the surgery. If it's something they like, great. If not, they could always go to a medical weight loss program as well.
But it isn't for everybody, though.
Correct. People have to be ready. They have to be prepared to make the appropriate lifestyle changes to make this a success.
Exactly, because you want that patient to feel good about themselves after making that decision.
Oh yes, of course. I mean, we do have people sometimes have the surgery, not sure what they're getting into, have regrets, but usually with time everyone realizes that it was for the best, but it's better to really be ready to get into this before you start the program.
Dr. Friedman, thank you so much. And for more information, you can go to griffinhealth.org.